With the theme The Future of Healthcare in the Global South with a focus on Sub-Saharan Africa on primary healthcare, procurement officers drawn from different countries in Africa have met to deliberate hits and misses in delivery of primary healthcare through sufficient procurement procedures.
We have very robust systems. You know, we have a very good regulatory system. We have a very good procurement system, well spelled out on how we should be able to procure things and all of that. But even the procurement systems and the laws, if you look at them carefully, do give some provision for extraordinary circumstances where you need to respond in emergencies very quickly. And I think that is the area that I'm saying needs to be a little bit more strengthened so that no advantage is taken of those flexibilities during a crisis period.
Many countries have a shortage of healthcare workers trained to deliver safe, effective and people-centered care for everyone. Health emergencies such as COVID-19 pandemic worsened the situation as services were disrupted and health workers redeployed.
In the beginning, I think in the beginning of the pandemic, one of the challenges they faced was the fluctuation of prices. We could not conclude a tender because while you are in the process, prices are going up. And what we did was to start by developing an emergency procurement policy, because this now is guiding our members. How do we balance the emergency procedures with the quality? Yesterday we had a good discussion here around the post-market surveillance, but also how we maintain the quality of drugs in our system.
Various faith-based organizations are discussing how to strengthen primary health services to create service available close to the community, reducing the cost that people face to get healthcare in Africa.
And this forum is coming now to discuss all those results, what we have realized in our different Christian Health associations, how our drug supply organization are coping with COVID and especially the disruption in the supply chain. But we also, you know, we found the signal that there is a challenge in the supply system because we are EPN. We are also coordinating what we call the East African Pool Procurement, and this brings together 4 drug supply organizations. We have been struggling to maintain and to make sure they are supplied by good quality medicines.
Okay. We know that it happens. So there are leakages sometimes in the supply chain itself. You know, so those are the things that our institutions must work hard to plug all these loopholes that create these leakages.
They are encouraging expansion of innovations and digital technology which can be used by some countries to bring primary healthcare services closer. All this requires significant investments in health systems, especially primary healthcare, to get better healthcare results.
And we have a system, we have established a system here. I believe this system in Kenya is also replicated in many other countries in Africa, where we have a very strong foundation that takes care of primary health care through what we call the community health units, where we have community health volunteers that are active at the level of the village and actually visit households regularly to screen people, children, old people, and then refer them up to the health systems, particularly at the health center level and level 3 and 4. So that primary health care is critical. We recognize that, and there will be serious discussion about that here as well.
The event is also a call to members and stakeholders to participate in exchange of experiences, challenges and threats in delivering pharmaceutical care and services with the universal health coverage agenda, while learning on the most impactful policies and strengthening pharmaceutical systems, especially in low and middle income countries, and incorporate evidence-based practices for effective pharmaceutical service delivery for future healthcare. For Ebro TV, Amode Francis.